Well, good morning. Here today on the traditional territory of the signatories of Treaties 6 and 7, and I acknowledge the Métis people who share a deep connection with this land. Well, thanks to leaked cabinet documents, which we released earlier this week, we know the full truth of Danielle Smith's plan to concentrate control of the healthcare system in the Premier's office and cause catastrophic chaos in our hospitals, clinics, and seniors' homes. Indeed, we know a lot more than the glossy presentation that the UCP wheeled out yesterday. We know that the UCP is going to actively drive away frontline workers as they impose the chaos of 13 new agencies, boards, councils, centers, and secretariats. New bureaucracy on top of new bureaucracy on top of new bureaucracy. And that's before they even get into the mass privatization plans, parceling up and selling off, contracting out different services that we clearly saw described in the cabinet presentation yesterday. Albertans don't trust the UCP on healthcare, and they have good reason. From their first day in government, one example, they began working to blow up our lab system and hand it over to what proved to be a company that could not handle the work. After 3 years of effort, 3 years, the UCP invested in this. What Albertans got was massive delays in appointments, huge delays in cancellations at the labs, and even dangerous mistakes in the test results. We saw the UCP slash food safety inspections, and then sadly hundreds of kids who were infected with E. coli. Dozens of them had to be hospitalized. Some even ended up on dialysis. Those are the consequences of badly planned changes to health. This latest radical disruption is not an attempt to make Albertans healthier or to provide Alberta's healthcare professionals with a better place to work. This is a power grab, plain and simple. But the results for patients and for healthcare workers are sadly going to be more of the chaos we've come to expect from the UCP. Now, we believe healthcare does need reform. We see the very real crisis unfolding in front of us. It has been for years under this UCP government. Healthcare workers are exhausted and desperate. We do need reform, but it needs to be through investment in those frontline workers, through a massive recruitment and retention campaign to support those workers, and true collaboration with those workers. But this, Danielle Smith's plan to concentrate power over healthcare in the Premier's office, well, that's only going to cause even more chaos in our clinics and hospitals, make life harder for those healthcare workers, and drive more away. I encourage Albertans to take a look at the government's own internal analysis of the risks of their own plan, which was leaked to us earlier this week. It talks about fragmentation of care. It talks about service disruption and or failure. Those are extraordinary risks, but we haven't heard a word about them from the UCP. Instead, Danielle Smith says she's 100% committed to a plan that experts and frontline workers are coming out to say will make health care slower, harder to find, and even more fragmented to access. It will mean inferior health care for Albertans, and that is simply unacceptable. Thank you, and I'm happy to take any questions.
We'll now go to the room for questions. Please state your name and outlet.
Hi, I'm Alysia from RD News Now. You were mentioning that this Smith wants to just have more power over the healthcare system. Would you mind explaining a little bit more about that? You know, what would a premier do with more power in the healthcare system?
So this is a topic that Danielle Smith talked at great length about when she was running for leader of the UCP, even after she became the leader of the UCP and the premier of the province. She was angry with Alberta Health Services. She felt that they did not do what she thought they should have done during a public health crisis when, frankly, healthcare workers and folks across the province worked diligently to save and protect lives. So she said she wanted to take her revenge. What we see here is Danielle Smith is now giving herself, through the Minister of Health, more power over the healthcare system directly. They are moving folks that work in Alberta Health Services into Alberta Health. They are creating a new division for primary care that will be answerable directly to Alberta Health. So where we formerly had much more of a separation, church and state, between government and the folks who were delivering healthcare and making decisions based on expertise, knowledge, and folks who have that medical experience, we now have it being set up for a lot more direction directly by the Premier. And given the clear anti-science views we have heard from Danielle Smith repeatedly over the last 20 years, I think that's a very concerning thing.
And we'll go to you for follow-up.
Yeah, one of the things she was mentioning was giving more decision-making power to local authorities, and that was something as well that local people were saying that they wanted. Do you think that this plan would not make that happen, and how do you think that local authorities could be given that desire to have more decision-making power?
There is nothing in the plan to provide more decision-making and authority for local folks in the healthcare system. Not in the cabinet documents that we released earlier this week or in their presentation yesterday. I think there's going to be a bitter disappointment. It's going to feel like a betrayal, I think, for a lot of the folks that she made this promise to. What we do see is they're going to continue to use the same regional councils that already exist. But we don't see anything about giving them more power and decision-making, more authority. What we do see is that she is taking a lot more power and authority for herself through the Minister of Health and into the Premier's office. So frankly, if you want to empower local communities, well, first of all, provide them with the resources they need to deliver health care. And what we have seen with this government is whether it's with municipalities, whether it's with the healthcare system, they have taken more and more of that from themselves. And they have downloaded more and more responsibility to others without providing the funding that's needed. So in this case, I think we don't really see anything here that is following through on that promise.
And do we have another question in the room?
Susan Zielinski, Red Deer Advocate. How would you imagine this change in the healthcare system will impact the Red Deer Regional Hospital expansion?
Now, that's a fair question. You know, at present, I understand they're still working through the planning phase of how the hospital is going to lay out work. But what we do know here is that they are fragmenting the system even more. So it's difficult to say when, I mean, here in Red Deer, of course, that hospital is serving a very wide catchment, all the local communities, all the people here in the city, and we know at this time there are no family doctors in Red Deer that are accepting new patients. So the Premier's solution for this apparently now is to create even more bureaucracy, make it even more difficult for folks to be able to coordinate, to take more control into the Premier's office over where doctors can be, or how they're going to operate, or the decisions they're able to make. So my concern is that in implementing this plan, they are going to be creating more uncertainty, more chaos. They're going to be spending months creating new org charts, hiring new positions, creating new bureaucrats at a time when they should be focused on getting the work done. The Red Deer Regional Hospital expansion is crucial. It is a priority. It would have been a priority for an Alberta NDP government. We had plans on how we wanted to work to accelerate that. When you are tearing down the system in which that hospital operates, I fear that they may be endangering how quickly that hospital expansion can be built.
Would you be concerned about who would be taking over organization of the hospital or running of the hospital once it is up and running? Like the UCP was mentioning that, you know, who knows who would be running the hospitals, the new hospitals, and this would have basically be a sort of a new hospital.
So that's a fair question based on a few things. We know that in the past, Danielle Smith wrote about, mused about private ownership of hospitals, having private owners be in competition with provincial providers. So that is on the record as something the Premier has previously considered. Her appointment of Dr. Lyle Olberg as the new chair for the board of AHS. Well, he's someone that has in the past opened and operated private hospitals that proved to be failures. So we have a premier that has talked about it. We have a chair of the AHS that has actually done it and operated it. And we have the cabinet documents where they talk clearly about AHS being only one of many providers working within this ecosystem. So I think we certainly have a lot of questions that we need to be asking about the direction that the premier may be choosing to head on this.
All right, thank you so much.